Hello everybody, welcome once again to my channel. This is Evangel. Today we're going to be discussing something very important. Meanwhile, thank you so much for the support, thank you so much for the subscription, thank you so much for the views. I really appreciate each and every one of you. And if you're new on this channel, please do not forget to subscribe, do not forget to hit the bell icon so that anytime I upload new videos you'll be able to get them. I am so grateful. I appreciate each and every one of you. This is a wonderful family I have got here. Thank you so much. So today we're going to be discussing something that is very important to everybody. I mean, to every couple, especially for new mothers, especially for first-time moms. Today we're going to be discussing some of the challenges we face after childbirth, especially for first-time moms. These things are quite common, but it doesn't mean it must happen to you, and it doesn't mean if you experience one, you will experience the second or the third or the fourth or the fifth or the sixth. So we are all different individuals and we react differently to different challenges in life and different conditions in life. Somebody who is pregnant, some people might experience nausea and vomiting, while other people will never experience. So today I'm going to be discussing some of these challenges, some of these common challenges that we face after childbirth. Some may happen just immediately after childbirth, and others may happen maybe a week after, 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks. But most times, some of these things will end by the end of the second month. So when you experience such, I'm going to be telling you what to do, some of the home remedies, and then when it is appropriate to alert your doctor. So the first I have on my list is bleeding after childbirth. Yes, bleeding after childbirth. It is pretty common, especially in the underdeveloped world. The bleeding after childbirth is very common, while in the developed world or in the Western world is a little, controlled. Is not as common as we have it in the developing world. And then this thing could be just from minor bleeding to heavy bleeding to even the type that will give you some signs and symptoms that you need urgent attention or emergency management. So sometimes some of this bleeding may start just immediately after childbirth, and it could be as a result of the uterus not contracting very well, and it may also be as a result of multiple pregnancies or multiple childbirths. It can also be as a result of infection of the uterus, especially when it happens like maybe some days after childbirth or some weeks after childbirth and you start bleeding. It may be as a result of infected uterus. And it can also happen especially if you have tear. If you have tear in the uterus, in the cervix, and in the vagina, you could also have bleeding after childbirth. And what do you do when you have such? In case of any bleeding after childbirth that is not normal, any bleeding after childbirth that is not normal, please alert your doctor. Especially if you have gone home, if you're no longer in the hospital, please alert your doctor. Now we could have something that is called Lochia. It is vaginal discharge, but it's bloody. At the initial time, it may just be like an exaggerated menstrual period. Yes, Lochia, you must have heard about it. At the initial time, it may just be an exaggerated menstrual period, but as time goes on, it just changes from bright red to pink and then to white. The color changes and then the flow reduces within few days. But in some cases, you notice that this Lochia persists for a longer time. Some people will tell me, oh, we have been bleeding or we have been seeing this bloody discharge for about a month or two. Now, there are a lot of things that may precipitate that or that may lead to such bleeding. If you notice that your Lochia or the normal vaginal bloody discharge that you have after childbirth, whether you delivered by SVD or you delivered by cesarean section or operation, most women experience such. Yes, so if this bleeding is not reducing in quantity and is not changing in color, especially when you're 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks after childbirth, then you should be able to alert your doctor. But meanwhile, before you alert your doctor, there are certain things that may make this bleeding and that may cause this bleeding not to subside or not to go away as it should. Some of these things that may cause this bleeding not to go away as it should is especially when you engage yourself in a vigorous exercise. When you will notice that this bleeding is reducing, and then you engage yourself in a vigorous exercise and it starts again. Sometimes you don't need to be worried, especially if it is still that low quantity. Now, another thing that may make this bleeding to come back even when it seems that it's going is when you are lactating, especially when you're breastfeeding. Sometimes after breastfeeding, you notice that this bleeding increased or this bloody discharge increased. So it's nothing to worry about. It's very normal. It happens. Now, another thing that may make this discharge to persist, but in this case, it might not be bright red, it might not be pink, it might be something entirely different. The color might be something entirely different. If you have any form of infection, any form of uterine infection or whatever infection that is happening down there. Yes, infection is very, very common because of the multiple examinations that will be going on and other stuff. So infection of that place is very, very common. But meanwhile, we will come to when a woman has an infection, either a uterine infection, a vaginal infection, or a bladder infection, because it's also part of the common happenings after childbirth. Anything around that place could be infected. Now, when do you know that this is probably a bladder infection or a renal infection, kidney infection? How will you know that this is a urinary tract infection? Because it's one common thing that could happen after childbirth. Now, for those who deliver by cesarean section, usually a catheter is passed to help you immobilize for the meantime or immediately after the delivery, so that you'll be confined to your bed. The catheter is passed. Most times, after the removal of the catheter, there might be some inflammation going on there. So a lot of women feel this pain on urination and all that. But meanwhile, it goes away, wanes away after some days. Now, if it persists, then you need to alert your doctor. You will have sometimes you may not be able to even control your urine. That is incontinence. Sometimes you will be having this burning sensation while urinating, and it may even graduate to having pain while urinating. And it can also be like a flank pain when you feel pain just down your back where the kidneys are located. Then you know that the likelihood of having a kidney infection is there. You need to alert your doctor. Now, apart from the postpartum infections, remember that the uterus could be infected, the vagina could also be infected. So when you notice that, oh, you are bleeding more, as in the lochia is more, what seems to be lochia is more, and then the smell is really not good. It has a very foul smelling odor. Then you need to alert your doctor. Now, if the discharge is not something you're comfortable with, the discharge probably is more and then is not the color you expect. Maybe it's changing to brownish, it's changing to blackish, that you need to alert your doctor. Now, going to number 3, another thing you may experience after childbirth. You could have pain in the perineal region. The perineal region is the region between the anus and the vagina. So you could have pain or tenderness down there. And it is not uncommon because, one, during labor, all the muscles located in this area are stretched. Yes, as the muscles are stretched, after childbirth, definitely you will have that pain until it goes back to its normal position. And there are several things you could do at home to help you regain your muscle strength. Something like seed baths will help to relieve the pain you're having. Seed bath. Seed bath is like you getting a warm water and then adding your Dettol. Some people will say add salt to it, but I just say add your Dettol or any disinfectant, Savlon, and then you sit on it several times, for some minutes, several times a day. This could aid to relieve the pain. Then another thing that could cause perineal pain is when you had a normal tear. Definitely some people during delivery, they are giving tear called episiotomy. The reason for this tear is not that they hated you, they just want to cut you. No, it's just to guide the birth canal so that it doesn't just tear on its own. It's better you give a tear to direct the head or the whatever the presentation is, to direct it and have a better delivery than allowing the birth canal or the vagina to tear by itself. If it goes ahead to tear by itself, this tear could extend to the rectum, it could extend to the cervix and all that. So when you're giving a tear, it's not because that they hate you. No, it's not because they're wicked. No, it's just to have a better delivery outcome. So when you're giving this tear, it could definitely, after childbirth, the pain will be there for some days, but it's good you have a good personal hygiene, and then you do these seed baths to just help you relieve the pain and also heal properly. So number 4 on the list is Lochia, or vaginal discharge. Remember, I've already mentioned it at the beginning that there is something called Lochia, there's something called vaginal discharge that you're likely to have after childbirth. And this vaginal discharge at the initial time is bright red and it's like an exaggerated menstrual period. But as time goes on, as the day goes by, then it changes from bright red to pink. And at that initial time, you may even have some blood clots. Yes. Now, as time goes on, it changes from bright red to pink and then to whitish or sometimes yellowish, depending on your body system. So this Lochia actually disappears with time over some days, maybe about 10 days to 2 weeks. It goes away. If this Lochia, if it doesn't go away after maybe a month, should you even wait up to a month? The thing is this, you check it. If the blood is increasing in quantity, the flow is increasing and is constantly becoming bright red instead of changing from bright red to pink and then to other colors, and then is increasing in bright red, and you are maybe having other symptoms of anemia like dizziness, palpitations, that's your heart is beating so fast, you're very dizzy, you're always tired, you're having constant headache, I think you should alert your doctor. Now, if this discharge is actually going down and then maybe you engaged yourself in a vigorous exercise or you engaged in a very stressful job or so, and then the discharge that's almost changing to pink or yellow or white now becomes bright red again, sometimes you don't need to bother yourself, because this change is as a result of the vigorous exercise or the stressful job you engaged yourself in. And if you're breastfeeding, remember, sometimes you will feel that this bleeding has disappeared or this bloody discharge has disappeared, and maybe after a bout of breastfeeding you see it reappear again. Sometimes it happens that way. There is nothing wrong with it, it's very much normal. But what you should look out for is if this blood is increasing, having more clots, and then you're having other symptoms that is not really you're not very comfortable with, you should alert your doctor. Secondly, if this discharge is actually weighing down and the color is changing from maybe pink to something else, maybe black or brown, and the odor you are perceiving down there is not so good, it has a foul smelling odor, alert your doctor. It could just be a sign that you are having some sort of infection. So that is it for the Lochia. I think this will have parts 1 and 2 because it's actually a very long discussion. Thank you. Keep watching, subscribe, share. Please guys, share these videos. People will have, they will learn a lot from it. Share these videos. Until I come your way next time, remain blessed, Be passionate about whatever you're doing, and do not allow anybody to look down on you. Do not allow anybody to talk down on you. You are you. You are you, and you are special. I mean, very special. From me to you, mwah.